This is Dr. Tom Roselle. After 43 years of practice and over 1 million patient visits, the Roselle Center for Healing knows what works and knows how you can take control of your health and wellness. My team of doctors practice 21st century integrative medicine. Whether you suffer from chronic pain and fatigue, allergies or headaches, we can help. Take charge of your health before it's too late. Make an appointment today. Call 703-698-7117 or visit online at rosellecare.com. That's rosellecare.com.
The information provided on Dr. Tom Roselle Live by Dr. Tom Roselle, D.C., interview guests, show co-hosts, or substitute hosts is not intended or implied to be a substitute for professional medical advice, diagnosis, or treatment. It is for general information purposes only. Information from this broadcast should not replace the appropriate consultation and examination process by a licensed physician. Always consult your own physician prior to changing any current medical directive or prescription.
Welcome to Dr. Tom Roselle Live. This is Dr. Tom Roselle. Indeed, we are live today, bringing you a very fascinating program, one that is seasonally appropriate for all of you, particularly now that we can all go out and we can do the things that we want to do and, have some fun, and there's no restrictions, particularly in Virginia. All the mask mandates were dropped. And so what am I talking about? Well, we're talking about something that can affect you in everything that you do, and it's called neck and shoulder pain. You're a golfer. You like to go out and hit the balls around a little bit. You're a tennis player. You want to get out on the court. You are simply, driving your car and you can't turn the steering wheel because your shoulders hurt. You can't lift your arms up to put something on the shelf. You lie down in bed and you have to make sure that you avoid that shoulder. You have to put a pillow between your arm and your chest. That's shoulder pain. And many of your shoulder problems, my friends, come from a misalignment of the neck. The nerves are being irritated, so the muscles aren't responding and firing the way they're supposed to. And it's something that, if it's identified properly, can be handled. My guest today, somebody who is really intuitive when it comes to shoulder problems. I've been very impressed with this doctor since he joined our team. None other than Dr. Jerry Cowart. Dr. Cowart, welcome to Dr. Tom Roselle Live. Again, you're finally becoming a proficient professional at being on the air.
Thank you. It's always a pleasure to be back with you guys.
It's, shoulder problems, most people don't realize, oh, my shoulder hurts, it throbs, it aches, and they're going out and getting some emollient, to rub into it. In today's world, CBD oils and things of that nature. But nevertheless, the shoulder now becomes frozen. It doesn't work. And sometimes you can't even, for a guy, you can't reach around and put your belt through the loops. A woman has a difficult time buttoning her bra. And all those things make our life much more difficult, to the point where it becomes extremely restricted. And we talked a little bit when I opened the program about playing tennis and golf and so forth. But at the end of the day, this can be quite profound. This Wednesday evening at the Roselle Center for Healing in Fairfax, and we're open for business. We're still being very protective of our patients, but we're back in-house doing our in-house continuing education programs. And you're going to present and demonstrate a lot of things that have to do with this whole thing. And the demonstration is something that you have to be there and present to see and make sure it happens. But let's talk about, this neck and shoulder phenomena, incidence-wise, as far as, people suffering from this. What are we looking at? Is it something that's extremely prevalent, or is it something that, just a few people get here and there? Oh, my shoulder hurts. Give me a couple of aspirin and I'm good to go.
Yeah, no, it's extremely prevalent. And as you touched about before, that when you have shoulder issues, you likely are having neck issues and coincide with it. Neck issues is the second leading cause of someone coming to see a chiropractor. So it's super, super prevalent. And then, going straight into the shoulder, about 15% of the population is going to have some sort of shoulder issues, every single year, and roughly 40 to 60% of those will never actually go away, left untreated. So this is definitely something that either you yourself can end up getting, or you'll end up knowing someone who will, very, very commonly.
Yeah, I don't know about anybody else out there, but when your shoulders are problematic, you can't lift anything. 10 pounds, 5 pounds, 3 pounds becomes something that is a monumental effort for you. You can't reach around to grab the door, so you're finding that you're moving your whole body. But here's a key. If you're in the car and you find that you're using your mirrors more than to have to be able to turn your head right or left, that is called a predisposing situation. And ultimately, you're going to find that your neck and shoulders are stiff. You're going to say, hey, why don't you rub my neck and my shoulders for me? Well, that's a clue. That tells you that something's not firing, not working the way they're supposed to. Let's kind of tip through this a little bit, and then we'll get into the effectiveness of treatment in the second half of the program. But let's talk about what sets these things up. Why, the prevalence is significant. Why do these things happen? What are the mechanisms of trigger, if you will, that allow us to experience this unfortunate situation? Now we can't throw a ball with our kid, we can't play tennis, we can't go out and play catch, any of those things. So what's happening here? How does it happen?
Yeah, so the real root for a lot of shoulder issues is going to be within the neck. And unfortunately, when we're dealing with any kind of structural problems, whether it's the neck or anywhere else in the body, oftentimes it's going to happen due to some sort of injury patterns that happen, whether it be a true gross macro injury like an automobile accident or a blow to head or whatever the case may be. But oftentimes it can also be those small micro traumas, those small repetitive motions, whether it be improper work ergonomics or improper sleeping patterns. All those things are going to predispose the neck to become misaligned and the biomechanics within the neck just not moving properly. And then that in turn is going to cause a lot of pressure and irritation within the neck, restrictions in the neck. Then it's obviously going to reflect downward into the shoulder and then also conversely even further down into the arm.
It's kind of interesting. We've had so many patients that have come into our practice for one problem or the other, and they don't think about the joint spaces that are away from the spinal system, but they've been to their physician and they've been injected with a steroid, they've been injected with something else, or they've said, oh, you have a tear in the rotator cuff. Well, there's many pieces of the rotator cuff. And is it a complete tear? Is it a little tear? Little tears heal up, and tendinous fraying heal up, and so forth. And there's a lot of ways to go after this in today's world, even from injecting things like PRP and Wharton's gel and to get them to heal. But now mechanically you still have to fix it, because otherwise you're designed to go back to do it again. But nevertheless, sometimes people don't realize it's a neck-shoulder mechanism problem. How do you make that determination? How do you decide that this, oh my gosh, my shoulder's aching and I've got to take whatever I have to take for it on an ongoing basis, is not the shoulder per se, but it's being triggered by something more proximal to it called the spine?
Yeah, so that's one of the things that I'm going to be really excited to do during the in-house lecture on Wednesday, is that we're going to be doing some show and tell of how we use manual muscle testing in our office to show the difference and show the locations of where some of the problems are coming from. So oftentimes you mentioned earlier where you'll have like weakness where you can't lift something up or you're not able to reach or anything like that. And what we can do is we can actually see by putting the neck in certain positions to see if that can have a cause and effect to regain the strength or be able to increase that range of motion in the shoulder. And if not, then we'll be able to do the same thing at different other joints within the shoulder complex, which there's, it's a whole complex there within the shoulder that it could also be stemming from. And, the option there is too that you could be having issues in both locations causing these types of issues.
It's interesting. Over the years, I've had the privilege of treating a lot of professional athletes, particularly NFL. Mm-hmm. And these guys are so powerful, so strong, that when they have something go amiss in their shoulder and any other joint space, all they have to do is shift just ever so slightly relative to how they're moved. So you get an offensive or defensive lineman that's striking out straight out, and instead of doing that, what happens is they shift their hand 5 degrees off center. Now they're compensating by using other muscles, but the problem is now they're adding more damage and injury to the joint, and they get it taped with K-tape, they get injected with all kinds of stuff, and to modify it so they can continue to use other musculature. However, all of us guys, that when we have a shoulder problem, unless we're really in good shape, we've been in the gym, we've developed a lot of intrinsic strength to those muscular areas. Now we lose the capacity of a muscle not to work, and nothing seems to make a difference. I'm going to bring one piece up to you that a lot of people don't realize is a stabilizer, just as important, if you will, as the rotator cuff in making sure that we have good joint motion. And that's the pectoralis muscle. It's the big chest muscle. The one in the front is the breast of armor, if you will. How can that muscle be injured? Why does that overlooked by so many physicians, orthopedists who are specialists in this area? They forget about that muscle.
Yeah, so a lot of times when someone first has a shoulder issue, as you mentioned, they're going to look at the rotator cuff because it is really common injured. However, when talking about moving the shoulder and activating any muscles in the shoulder, some of the first muscles to really activate to help stabilize and to allow it to move is going to be like the subclavius muscle, and as you talked about, the pec muscle.
So the subclavius muscle, for our listeners, is your muscle underneath your collarbone.
Absolutely, and it's going to be one that we definitely talk about on Wednesday lecture as well, because it's another one, as you mentioned, that I find a lot of people end up overlooking. But with the pec, you're definitely seeing where, because you're not having proper motion in some of your other main big muscle groups within the shoulder, that guy's going to constantly take a lot of extra wear and tear that it doesn't need to necessarily take if all the muscles are currently balanced and working as properly. It's going to help draw the arm downward. So if it's just locked and contract, you're not going to be able to move the muscle or the shoulder girdle at all. So it's definitely one that gets overlooked a lot, and it's constantly contracted. And a lot of times it's due to our posture. And, I mentioned work ergonomics before. A lot of the postural patterns is just going to tighten and shorten that muscle pattern, and it's just not going to be able to allow the shoulder to move as optimally as it needs to.
Yeah, it's a mechanism that, and I'm not talking about what you were saying specifically, but the shoulder, the intricacies of that shoulder group is really important. What I want to do is when we also get into the next part of the program, I want to talk about the mechanics of the shoulder as it relates to other joint spaces like the hips and so forth. They, in a normal, what we call gait pattern, the way we move, the way we walk, we're out playing golf, how we're moving with our tennis racket and so forth. The body isn't isolated to one piece or another. There's a lot of different parts that have to be appreciated, if you will. And if they're not, you can't fix anything. They just keep coming back. But, we'll touch a little bit on a frozen shoulder, and that means that you can't lift the arm up well. You said a little bit about the mechanisms of that shoulder affecting the collarbone. And if that collarbone doesn't move, you can't raise that arm up. You can't get it above your head. It's not going to go anywhere. It can't go backwards. So we're going to try to make sense out of that, if you will. This Wednesday evening, Dr. Cowart, you're going to be doing a presentation at 7 p.m. at the Roselle Center for Healing in Fairfax. And we'd love to have as many of you back in office as you'd like to be there with us. So you can call the office at 703-698-7117. That's 703-698-7117. Or simply go online at rosellecare.com and register there. You'll find it, get it done, and we'd love to see you Wednesday. We're coming up to a break. My guest, Dr. Jerry Cowart. Don't go away. We'll be right back after some important messages.
WMAL's Free Speech Forum is back September 25th at the Birchmere. Grab your tickets today. Details online now at WMAL.com/Free Speech Forum.
Welcome back, everybody. This is Dr. Tom Roselle. You're listening to Dr. Tom Roselle Live. Indeed, I am. My guest today, Dr. Jerry Cowart, one of our brightest and best. I get very saddened by these guys. Not saddened because they're not good guys. Saddened because they got more years ahead of them than I do. And I'd love to be able to be in their position and take what I know and keep adding to it and so forth. But so you understand, Dr. Cowart, what I'm saying is I'm jealous, right? So just understand that. That's all. That's what this is all about. We're talking about shoulder pain, neck and shoulder pain, and how it comes about. And particularly this time of the year, we're all trying to get active again, particularly after all the nonsense for the last year and a half. We want to play a little tennis. We want to, get a little exercise in, a little golf. But we're finding that our neck and shoulder mechanism isn't working the way it's supposed to. Now, Dr. Cowart, this Wednesday evening, you're going to be doing an in-house presentation on this subject, and we invite, our patients and their friends to, if you have an interest in this, this is an opportunity. Please join us. You'll have a great time. Virginia, all the masking restrictions have been lifted. However, you're more than welcome to wear a mask. And we have HEPA filters, and our office is still very, very protected. So we want to make sure that you're at ease when you come to visit us. However, this Wednesday is one of those times when you can figure out how to get your golf game back because your shoulder's been bothering you, or you can start playing tennis again, or you can reach around and get your belt on without saying, "Oh, my shoulder's hurt." So, Doc, we got just a couple minutes to touch on this. Is the shoulder isolated from other parts of the body, or is it something that begins to, because there's no direct injury, can be predisposed just by overuse because it's compensating for something else?
Definitely the latter. The old nursery rhyme, the hip bone's connected to the knee bone nursery rhyme. It's very true when it comes to the body. Everything is really interconnected. There's a concept of, gait patterns and interlink where you have equal and opposite parts of the body that work very much in tandem with each other. So if you're dealing with the shoulder, it's likely that it can be predisposed by some sort of issues in the opposite hip, and or vice versa. Same thing within the neck. Anything that's dealing with the neck could be predisposed due to something that was happening in the low back, or again, vice versa. So when you're dealing with the neck or you're dealing with the shoulder, one, you have to look at both. Two, you also have to look at elsewhere in the body to see if there's anything else that could also be contributing to it.
Well, and that's something that most people would not even begin to consider. If you have a right hip problem, you can end up with a left shoulder problem, and vice versa. Your elbow and your knee, your wrist and your ankle. And that's normal, what we call normal gait patterns. That's how the body works in an orchestration, in a synchrony, one to the other. And it's really important that you understand that. And by the way, love to talk to you today at 888-630-9625, 888-630. That's what happens when I go away. I forget all the phone numbers, but we're there. You can give us a call. We're good to go. The brain, I start traveling, my brain goes into shutdown, and not really, but that's neither here nor there. So, but this whole neck and shoulder problem, little injuries to the neck can cause a problem. Why is that? In the few minutes that we have left, why does neck injury cause a shoulder problem, Dr. Cowart?
Yeah, because all the nerves and nerves that come and innervate the muscles down into the shoulder and to the rest of the arm all originate from the cervical spine or the neck. So if you have any kind of injury or misalignment or dysfunction within the neck, you're basically kinking the water hose that goes into the shoulder, i.e. being the nerve roots and the other peripheral nerves that come from it.
So what I want our listeners to think about is when that takes place is very much like taking a dimmer switch. And you have the electrical flow going there, but it's not optimized. So subsequently, it's not working the way it's supposed to. The nerve can either be overstretched or it can have some pressure upon it. If that happens, obviously the target where that goes is not going to be functioning. Here's the other thing, and we'll touch upon it a little bit when we get in the second half of the program, is that every muscle in the body relates to different organ systems. And there are several of the muscles of the shoulder that relate to lung. So if somebody is a smoker, if they're exposed to fumes, like in a beauty salon, if you will, you're around chemicals all day long, those things will irritate lung tissue, which irritates the nerves. With the nerves not firing the way they're supposed to, the muscles that are associated with them are not going to work properly. And everybody's saying, "Oh my God, what's that all about?" Well, kids are out there vaping, and we're exposed to all kinds of things. There's so much that we can point to, but if we point to the right fix, then this thing resolves itself and you get your life back and you can do all the things that you've been putting on hold. We're here at 888-630-9625. That's 888-630-9625. Love to talk to you today. Dr. Cowart is my guest in studio, your presenter this Wednesday evening at the Roselle Center for Healing in Fairfax. And we're going to be talking about this. We're going to be talking about shoulder problems and your inability to do what you want to do and have the life that you want to have. And, you've been out, you've been injected, you've been taking medications, and as long as I take whatever, I can tolerate it. Why tolerate it? Fix it. This is an opportunity. We're going to do some demos. We're going to do some show and tells. This really is your time to figure out how to get your life back and get a little strength back in your body. It's more important. Dr. Cowart is an amazing technician when it comes to fixing these problems. I watch him and I'm totally in awe sometimes. Like, where did you find out how to do that? Give us a call. And more importantly, don't go away. We'll be right back after some very important messages.
Dr. Tom Roselle Live continues now on 105.9 FM, WMAL.
Welcome back, everybody. This is Dr. Tom Roselle. You're listening to Dr. Tom Roselle Live. Indeed, we are. It's a lovely day outside. Make sure that you have the opportunity to go for a walk, play a little tennis, a little golf, go for a swim, something like that. But many of you say, I can't do that because my shoulder hurts and I can't turn my neck from side to side. And guess what? That's the program that we're talking about, how to deal with those types of things. My guest in studio today is Dr. Jerry Cowart, who is an amazing, amazing expert on shoulder pain and fixing it, without having to inject it and those things. Although, we do have the opportunity for PRP and things of that nature when there is actual damage to the tissue is a primary situation. But so much of our experience, our inability to do certain things that we put up with, that we set aside, has to do with normal functional consideration. Dr. Cowart, welcome back. This is a program that you're going to do this Wednesday at 7 p.m. at the Roselle Center for Healing in Fairfax. We're just off the National Capital Beltway, and we'd love to welcome back our listeners for our in-house continuing education programs, which we've lovingly called them for many years now. This neck and shoulder mechanism problem, these rotator cuff problems, the popping and grinding that a lot of people get, the swelling, the irritation, the pain, the radiation. It goes into the neck, goes into the shoulder, goes up in the neck. So what comes first, the chicken or the egg?
So really, it can end up happening either or, but oftentimes we do see central structures such as the neck really affecting it first. Once those issues arise, sometimes you may not have pain associated with it, but maybe like a little bit like achiness or just like restrictive motion, or maybe you don't necessarily feel it at all, but then you have maybe some weakness to it. And so you just kind of ignore it, shake it off, or like you said, maybe like take some sort of medication to dumb it down. But then it starts manifesting and starts festering and becoming more of a problem. And then because of the pathway going down into the arm, it starts going into the shoulder and then to the forearm, and ultimately you can go into the hands. And so you always kind of have to look centrally first and then look outside of central, but it could be more than one area really.
Yeah, when it comes to shoulder problems, this is something that is really, I'm not going to I will say convoluted, but what I want to mean is that there's many different systems that can be involved in this thing. If you find yourself that you go out and you're having to modify how you deal with something. For example, you're playing tennis and you have to change your racket position. If you're playing golf and you have to hold it differently just so you can get out there, that tells you there's a problem. Don't let it go. And don't just sit there and say, well, I can have it injected. When I've treated so many of our professional athletes, whether they're basketball players, much more experienced with the NFL, the old, the Washington football team as it's called now. Unfortunately, I still love the other term, but that's neither here nor there. But these guys are monsters. They're strong. They're tremendously capable of doing all kinds of things. And that's part of those all kinds of things is hiding injury by just shifting and changing positions. If that sounds like you're putting up with, this is really something that you need to explore and know because it can be fixed rapidly. And if you can identify the exact mechanism, then we have an opportunity to be able to change it. Dr. Cowart, for our listeners, when you have somebody who is a tennis player, a dancer, you're a dancer, you love to dance, your arms are up in the air all the time. How does that mechanism show itself up? How do people compensate? They can't dance. They're out there trying. I'm not the guy that's going to go out there and do salsa and things of that nature. I did back in the day, but not anymore. But let's talk through that. That's something a lot of people do. People love to dance. It's one of the best exercises that any of us could do. Talk us through that. Talk us about the injury patterns that are associated. And by the way, we're here at 888-630-9625.
Yeah, so when we're dealing with any kind of activity, obviously I love to dance, as you mentioned. You've been talking about like tennis and golf because of the summertime, and what better time to do those types of things. You're going to start noticing that, this doesn't feel quite right like it used to. So when you're dealing with, something especially like dance, there's a lot of muscle memory that is involved with that activity, which goes for any kind of sport. And when you have that muscle memory and your arms are so used to like being in a certain position, I'm talking about arms in this case because of neck and shoulder. And then you start to notice they don't feel quite right, or I'm not able to express as far outreaching as possible if you're doing a dance, or like you mentioned, the racket has to slightly be changed, or I have to hit it at a slightly different angle. Or you'll notice that, if you're doing tennis, that the ball keeps like going in the wrong slight angle than what you intend it to be. Those are all clues that your body's starting to compensate for other injury patterns that maybe you don't necessarily feel, but you're starting to see it. And by feel, I mean like pain patterns, things of that nature. So that's when it really becomes a clue. It's like, okay, I probably need to look into this because, left untreated, left ignored, it's going to fester and become a much bigger problem.
Let's hold that thought. Let's go to the phones. Dave, thank you for holding on. How can I help you, sir?
Yes, sir. My neck, and in the past few months, it cracks a lot. And there's no real pain associated with that. It just was concerning that was concerning. And plus, I have a kind of a sore trapezius, but I work around it with my weight workout. But the neck cracking is concerning to me.
As it should be, Dave. It's not something that is normal. People hear their bodies crunch and crack, whether it's a shoulder, whether it's a neck, whether it's a knee, whether it's a hip. And if muscles are working the way they're supposed to, and there's no injury or damage to the joint space, you're not going to hear that. That cracking is called crepitus. And crepitus can be just a clue if it's short term that says something's not balanced properly, something's not aligned properly, or it can be something that says, hey, listen, you're starting to get joint space deterioration and breakdown and degeneration. At the end of the day, it's not normal. I'll have patients that have come into the practice and they'll say, I move and I crack and pop and snap all the time. And then we start treating them and all of a sudden it goes away and said, do you still feel it? No, it hasn't happened quite so much because things now mechanistically are working properly. They're working the way they're supposed to. And it's the same thing with a knee joint or a shoulder joint. But if you're moving your neck around and you're getting that popping and snapping, or you're getting a grinding type of sound, that crepitus is telling you that there's injury, there's a joint damage. Your trapezius muscle that you mentioned, if it's not firing properly, it's a stabilizer. It's a primary neck and shoulder stabilizer. It holds that shoulder up and slightly posterior. You have three parts of that trap. You have the upper trapezius, you have a middle portion, you have a lower portion, and they all have nerve root innervations that come from the spine. If the nerves are not functioning properly, if they're not working the way they're supposed to, that muscle becomes inhibited. Now, you can exercise it. You can use weights with it. And let's say that, you're doing it well. Now you're going to get 100% of what the muscle is capable of, but the muscle may only be capable of about 75 or 80% full capacity. So you're getting 100% of that 75 or 80%, but it's not working properly, so you become more predisposed to injury. Dr. Cowart, you want to jump in on that a little bit?
Absolutely. You definitely touched on some really good points to that, but me with me and the level of functional neuro, I do like to go a little bit further. If you've got the constant grinding in the neck, maybe there was some sort of trauma or blow, maybe some sort of automobile accident or anything like that. Because not only do you have nerve root innervation going to not only the upper trap, but the whole trapezius muscle as a whole, it could also be potentially brainstem related. So you may be looking at more centralized neurological function on top of localized biomechanical function as well. So there's a lot of different things that could be looked at with something seemingly as simple as just neck grinding.
This Wednesday evening, Dr. Jerry Cowart will be your presenter at the Roselle Center for Healing in Fairfax. Join us. We're going to be talking about all kinds of things like this. And, this is a problem that our last caller brought up that can be quite significant if it's not addressed properly. And over a period of time, things begin to worsen, and then pain shows up. And, we try to modify, because that's what we do. We try to modify so we don't hurt ourselves, but it is all of that. We're here at 888-630-9625. And by the way, I'm going to go back to the phones. We have another caller on. We have a surprise coming for all of you, and make sure you keep listening to Dr. Tom Roselle Live, and we'll give you more information as next week comes around. We're going to tie into the radio program. We're going to tie in a podcast that'll be from 12 to 1 o'clock every day. We'll tell you how to find it. The radio program will be part of it. You actually get to see us do the program. We'll actually have to dress up. I can't sit here in my sweats anymore, with a headset on. So we're going to, do that. So Dr. Cowart, you're going to have to look pretty for, when we start doing this podcast. But we're going to have one every day on different subjects. We're going to interview people, and hopefully it'll give you the data that you deserve, that you need to have on all different types of subjects. So stay tuned. Go to drtomroselle.com, drtomroselle.com, and watch for its announcement. It will be there. And in addition to that, for this lecture, this Wednesday evening, you can go directly that and then pop into Roselle Care or the Fairfax office, and you can register for this class, or simply call 703-698-7117. Melissa, thank you for being patient. How can I help you?
Well, my son, one of my sons, is very sick with a cold, and he's in his mid-30s, and he has to make a plane trip to Colorado tomorrow, and there's no way he can postpone the trip, so he has to go. And I told him to take vitamin C and zinc, but I don't know how much he should take. And can you tell me, is there any way he can get a miraculous cure in a day?
If he was in the office, we could drain those sinuses and open up the respiratory pathway. Zinc and C will help. You got to take a whole lot of it, and there's some other natural antihistamines. So what I would do is I would go to one of the either Whole Foods or Moms and so forth today, and ask them to give you a natural histaminic problem. Quercetin will help with vitamin C. So if you take about 200 milligrams of quercetin 3 to 4 times a day between now and tomorrow, with 1,000 milligrams of vitamin C, maybe 4 or 5 times, that should begin to help eliminate any kind of dairy, oranges, orange juice, because they're mucus forming. If you think about putting orange juice or oranges in your mouth, you can, it kind of gets thick. That's what it does to the sinuses. Dairy products will plug them right up, but eliminate those things. Lots of water, lemon and lime in it, particularly warm, no ice, and that also helped to drain. Tell him to make sure his bowels are clear, because the intestinal tract relates directly to the sinuses. So doing those kind of things should be useful, and it may help make the trip a whole lot easier. But he's going to have to make the judgment call tomorrow. But I would do those things today. Obviously, you can use what I call nose dope, but I wouldn't recommend that, because it is, it has other side effects. So anyway, have him try that. Melissa, I think you know how to get a hold of me. Let me know. We're here at 888-630-9625. My guest, Dr. Jerry Cowart. He will be your presenter on neck and shoulder problems this coming Wednesday evening at the Roselle Center for Healing in Fairfax. Let's go to the phones again. Fred, how can I help you? What can I do for you today?
Yes, I have a real shoulder problem, and I'm pretty sure I know where it came from. I've been in a number of automobile accidents. And I kind of worked through part of it, but one of the problems I have is if I point my arm in front of me and raise my arm, I can do it painlessly. But if I point to the side and raise my arm, I can only go up to about shoulder level before it hurts too much. And my biggest concern is I can't do push-ups because the pain is too much for me in the shoulder when I try to do push-ups.
Dr. Cowart, do you want to handle that?
Yeah, it sounds like we've got some impingement type issue. So oftentimes when you have some sort of impingement, there's the bony structural components within the shoulder that is compressing certain tendons and muscles. And so we're dealing within a rotator cuff type scenario with that. It kind of depends on the level of when you start developing that pain. When you start to raise it, would tell me exactly kind of what muscle or muscles are being involved or what bony structures are being involved. But it definitely seems very indicative of type impingement type scenario. So pretty simple to work through on that one.
So Fred, let me ask you a couple quick questions. If you're hopefully you're still on the line. How long ago did you have the accidents, the car accidents?
Several years ago, and I've had the pain for years.
Yeah. So little things can add up over a period of time. So it can be made worse by car accidents. It can be made worse by sleeping positions. It can be made worse by allowing things to just persist and ignored over time. So the nerves that come from the lower part of your neck, particularly from the middle of the neck down to your, where your shoulders start, if you will, those are the nerves. They're called the brachial plexus, or the neck is called the cervical spine. So it's the cervical brachial plexus. Those are the nerves that come out and they go to the shoulders, the deltoid muscles, the supraspinatus, the infraspinatus, the chest muscle. There's a big nerve that comes down to the outside portion of the chest called the long thoracic nerve. If the neck is misaligned, if it's out of position, it causes those nerves to either be stretched or pinched. The cord at that level can be stretched or pinched as well. And so subsequently, you can have all kinds of irritation and problems that predispose to the pain. The pain then comes from a localized notice, if you will, swelling and tearing, and you end up with these noxious stimulators, pain stimulators. But identification of that, as Dr. Cowart says, it can be fixed. It's not something to put up with because it's just going to get progressively worse. If we can help you, please give us a call. But join us Wednesday evening, and we're more than happy to even take a quick look at it as our gift to you. We'll do a private demo, and we'll see what's there. Let's continue along the line because everybody seems to be on topic, but we have one more call. We'll wait till we come back after the break. My guest in studio, Dr. Jerry Cowart. We're talking about neck and shoulder problems because, you know what, it restricts us from doing all the things that we love to do, golf and tennis and dancing and just swimming and all kinds of things. Don't go away. We'll be right back after some very important messages.
Washington's Mall, 105.9 FM, WMAL.
Welcome back, everybody. This is Dr. Tom Roselle. You're listening to Dr. Tom Roselle live, as you do every Sunday at 11 a.m. on the Eastern Seaboard. We're excited. We got some very, very interesting news, and what that it really is all about is that we're going to put together a podcast for you that's going to tie into the radio program. So those of you who have your computers and your iPhones and so forth can take us everywhere with you, but you get to see us, and we're going to do some demonstrations and some great interviews, and it's going to be Ageless Health, your unlimited capacity to do all kinds of things. So it's going to be fun. We're setting up a professional studio, and I'm going to have to get an earbud instead of my headset so I don't look like a space creature talking to you. But it's going to be fun. So you'll have the ability to listen to us 5 days a week from 12 to 5. So stay tuned. You go to either drtomroselle.com, 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 or go to rosellecare.com, and they both interrelate one to the other. And we've got we've got a great store for you set up there with all kinds of nutrients and different products. So check those out as well, and you can get them straight up. And as always, if you'd like to talk to us when we're not on the air, you can simply do that by sending an email. We'll get back to you if you need to have a response right away. 703-698-7117. And that's how you register for Dr. Cowart's presentation this Wednesday evening. And any questions that you have to have answered, you can do it through email, or you can do it on the phone. But make that happen. We want you to be our guest. We're having fun with this, but we're having fun because we get to serve you. Mike, thank you for being patient. How can we help you, sir?
Hello, sir. Thank you. And first off, I want to pay homage. Been listening to you for years. Really appreciate your show. And I'm excited to hear about your podcast. And congratulations. And I'm sure I'll take advantage of that because I'm not always able to listen on the radio. So that's great.
You know, I guess that, Mike, I guess that goes to prove that you can teach an old horse new tricks, right?
That's right. And I'm a middle-aged horse, I guess. I'm 42. I'm a contractor, and what my company does is not really heavy, but ironically enough, I work with people with disabilities. And I've had lower back pain for probably more, I don't know, I probably did something earlier in life. I used to box. I used to do some martial arts, and I don't know, that could contribute to it. But if I work a long day, overtime, basically, you know, a long strenuous day, I'm in a lot of lower back pain, and the next day it continues. And the only thing that really, inversion tables have helped. I've tried to stretch it out, and I know I have some minor bulging in some of my lower disc, but getting a massage really helps. It really rejuvenates me, but I get worried with all this popping that they do. And I don't know if that's helping or hurting more. I don't want to, you know.
Well, first of all, a massage therapist shouldn't be adjusting or causing that type of problem. They should be dealing with tissues. A chiropractor is the only person that has the bandwidth on that with 5 years of professional education after undergraduate school. So you have to be very careful with that. You want to be extremely specific when those things, and only a chiropractor really is trained to do that accurately and specifically. Now, having said that, Mike, when you have back pain, particularly at your age, it's not a good thing, and it's one that really has to be taken care of. There's only three things that can cause anything, my friend. One is there's injury repetitives. The kind of work that you do is obviously going to be a strain situation. The kind of activities, you know, back in the day from, you know, combative arts and so forth is going to put a strain on that type of thing. Dietary patterns, things that you eat that you shouldn't eat, things that you need more of that you don't get enough of, can cause an inflammatory response that causes tissue to begin to break down. So you roll the clock forward beyond where you are and you get closer to my age. And, you know, I did a lot of that silliness. I played Division I football in college. I was a running back, and as you can imagine, I got my butt handed to me. You know, then martial arts and Greco-Roman freestyle wrestling, multiple car accidents, 44 years in practice, you know, dealing with a lot of different types of conditions. It stacks. If it hadn't been for the fact that I was treated with the best of the best, I probably would have succumbed back in the day when I was your age or a little bit older. So at the end of the day, you can be fixed, but it has to be done properly, and you have to evaluate the structure. So the popping sounds, if it's you moving and causing the popping sound, is, again, we go as crepitus, and crepitus can be in any portion of the spine, any joint space. It doesn't make any difference where it's coming from. It just simply means that you're getting popping sounds and grinding and so forth. And but if it's, you know, if it's that in addition to muscle weakness, the fact that massage helps you and makes you feel better tells me that you have a lot of muscle imbalance until you get back on your feet and you do some other things. So the whole idea is to find out where it is, get those to fire properly, maintain them, support them, and then be able to move forward. We have several patients that are contractors that, and I say several, we have many, many patients, but several of them have been mine that have been with me for 30, 35 years, and they come in and they get treated to maintain themselves because they're out there. They're the kind of guys, even though that they own sizable companies, they still like working with the tools. But the only way they can do that is they have to look at structure, not only to get treated properly, but they look at structure to maintain that strength within their body by doing specific type of exercises. Biochemically, they know how they put the right fuel in the car, right? If you have somebody car that needs 93 octane and you're feeding it 87 octane, you got a problem. The body's the same way. So happy to help you. It can be identified very straight up. Find out what it is structurally, chemically, stress patterns are involved. We'll get it done. My guest today, Dr. Jerry Cowart, will be your presenter this Wednesday evening at the Roselle Center for Healing in Fairfax. Give us a call, 703-698-7117, and register, or go online at register at rosellecare.com. Dr. Cowart, thank you. This was way too fast of a program. I'm looking forward to hearing you this Wednesday evening. We'll see you then. And we'll see all of you next week. And remember, we do this program for one reason only. We love you all. Bye.
Breathe clean filtered air with an Airtamer Personal Air Purifier. It's easy to have filtered air with an Airtamer Personal Air Purifier. An Airtamer Personal Air Purifier emits healthy negative ions to push airborne pollutants away from your breathing space. It's purified air wherever you go. The Airtamer Personal Air Purifier reduces viruses by 99% within 20 minutes. Go to drtomroselle.com/products to get an Airtamer Personal Air Purifier. For a limited time, use the coupon code Roselle and get a 20% discount and free shipping. Order today.
Are you dental phobic? Do you neglect your dental health because of fear and anxiety? A beautiful smile begins with exceptional dental care, and you can trust in the expertise of Soft Touch Dental Care and Dr. Michael Chung. Soft Touch Dental Care is unlike any dentist office you'll ever experience. Their warm and welcoming environment is designed to soothe fears and anxiety the moment you arrive, and they're especially pleased to pamper their honored guest patients. Dr. Michael Chung is a professional and leading expert in all areas of comprehensive dentistry, including cosmetic, sedation, neuromuscular, TMJ, and implant dentistry. Offering state-of-the-art technology, Dr. Chung can give you the smile of your dreams. Arrange for a complimentary consultation today with Dr. Michael Chung and experience the expertise that makes Dr. Michael Chung so unique. Call 703-319-6990. That's 703-319-6990. Or visit bestinsmile.com. That's bestinsmile.com.
Are you suffering from flu-like symptoms? Get relief from muscle and body aches, headache, chills and fever, cough and congestion with Oleander 4X. Oleander 4X, made from oleander extract, is a tincture that provides relief for flu-like symptoms. Get relief with Oleander 4X. Go to drtomroselle.com/products to get Oleander 4X today. For a limited time, use the coupon code Ageless Health and get a 10% discount. Order today.